is dedicated to a woman who broke my heart, caused me a lot of pain. Here it goes.
Oh, baby, why me late? Oh, why? I need the moon, love, I got 'em on.
Am I on? Okay. Hi, I'm Buzz Savage, good friend of Len Collins, host of the Just Chillin' Show. And right now, you can call this number, 861-4246, for a special giveaway.
Love, I got 'em on,
That was the Transitions from their CD, and that was cut number 10, A Rainy Night in Harlem. But I'm told that that's about the only old school sound on this CD, so you might not want to rush out and buy this just based on that. I understand some other stuff has some pretty foul language on it. Just a little disclaimer on that, but it's the Transitions. If you've just tuned in for the second half of Just Chillin', again, my name's Jim Joyner. I'm your urban navigator for this program. My guest is Elise Ellick, who is the adolescent or teen counselor with the Division of Adolescent Medicine, Metro Health Medical Center, Women and Children's Pavilion, and also wears the hat of director of the Adolescent Consortium, Center for Adolescent Health, Case Western Reserve Universities. We spent some time in the first part of the program defining adolescence. We just finished talking about the fact that adolescents should have those safety nets, people they can talk to. That's inclusive of teacher. Well, my personal opinion, I think parents ought to be that first. But other significant adults, extended family, grandparents, teachers, counselors, friends, folks who have some value that you see modeling the kind of values and behavior that you want to capture in your life, that's important. What are the issues for adolescents today? I know that sexually transmitted diseases continues to be, we're inundated with the stories of violence. What do you see in terms of issues for the adolescents that come through that you have to address as a counselor in that regard?
Well, I think that there are a number of things that we consider an important part of a visit and for a patient's coming in to be seen. And I think that one of the most important things to keep in mind when we're talking about adolescence is that adolescence really is about one of the tasks of being a teenager is learning who you are, trying on different hats, trying on different behaviors, hopefully taking what we would consider some calculated risks, and by that I mean being challenged in different situations and finding out about what your level of decision making is. So that can apply to a whole range of behaviors. A lot of the young people that we see, we're going to talk to them about whether or not they're sexually active. We're going to talk to them about if they are sexually active, what they need to be thinking about in terms of whether or not they feel ready to face a risk of parenthood or whether or not they want to delay parenthood. Whether or not they want to think about being on some kind of contraception. And those are new things for a young person to negotiate and to consider.
Well, let's just stick with that point. A young person makes a decision for whatever reason, right or wrong, to be sexually active. And in that process, they're not engaged in use of any kind of barrier
or
protection. I'm skating around that term safe sex because I really think that's been abused, but that's a personal thing. What kinds of issues do they face? Let's keep it real, as they say in the program. You have unprotected sex, you run the risk certainly of becoming a parent.
Acquiring a sexually transmitted infection.
Transmitted diseases, a lot of kids may still think that, well, if I get something, I'll just go get a shot at the free clinic and it'll be taken care of. That's not the reality today, is it?
Yeah, this is a new world, and so we're not talking about infections or diseases that can always be cured with an injection or a shot. And so we want young people to understand that it's extremely important that they protect themselves and learn about condom use and talk with their partner about condom use if they are sexually active. And a lot of times, because people don't really necessarily feel very comfortable talking about how to protect themselves, or they may not imagine that they're going to have their first sexual experience at any particular time. They may not be prepared when that time comes. And so that means that if I'm talking with a young woman or a young man in my office, we're going to really have a pretty down-to-earth conversation about how they can go to a drugstore, how they can purchase condoms, what they need to know in terms of...
But what if they say, I only date nice kids like myself, so I don't have to worry about that other stuff. Or she's on birth control, I'm sure she'll take care of it, I don't have to worry about that.
Well, one of the things that we want folks to understand is that responsibility means not only knowing what your duty is, but what you expect, and what kind of respect you have of other people, what kind of expectations. And so lots of times if someone says to me, well, gee, I'm not going to be sexually active, or that's not something that's going to happen at this time, my message to them is, abstinence is fine. I certainly endorse that. It certainly lowers the risk for parenthood or acquiring a sexually transmitted infection. But if at some point things raise to another level, it's very important that that person know how to protect themselves. So there are lots of safety measures that I talk with young people about on a daily basis. And just as I want you to know how to drive a car safely or put a seatbelt on, I want you to know how to use a condom, so that if the time comes that you need to use one, you're not contemplating that for the first time and feeling awkward and then not protecting yourself.
Right. And I want to emphasize, and I guess again, this is my personal value sneaking through that I think when adolescents look at the choices, that certainly abstinence is probably the best, because until you are emotionally and physically ready to accept the responsibility, one shouldn't do it. And then to build on your point, you know, when we forget to put on our seatbelt or lock the door or whatever, at least an innocent life isn't brought into the mix as a result of that. I mean, a person may lose their life, but when we engage in that kind of behavior, I think we have to look beyond ourselves. We're down the last, again, 3-4 minutes. Time goes real fast. Quickly, alcohol, other drug use. What are you seeing among adolescents regarding alcohol, tobacco, other drug use?
Well, similar to what I said a little earlier about kind of we look now and say, well, gee, is behavior different in terms of violence than it was 30 years ago? I think that the substances change, but the behavior really doesn't in terms of risk-taking. And one of the questions can come in, which is, what really is the role of parents in this situation? And so we really want to encourage parents to talk with their daughters, talk with their sons about what their personal feelings and philosophies are about substance experimentation or use, just as we want parents to be the primary sexuality educators of their children. And so I think that it's important that young people know that they do have resources at home, but by the same token, we know that not all young people are going to come to a parent and say, ask questions about marijuana use or ask questions about sexual activity. And parents sometimes may take for granted that their daughter or son knows what their philosophy is, and so they may not sit down and have a candid conversation with them.
And a lot of times parents, if they wait for their kid to come to them, it's not going to happen. But if parents initiate the conversation long before they become 15, 16, it's a little too late then, but early on, age appropriately, then they've established the foundation for that to happen. I want to make sure that we get the resources in. Adolescent Medicine at Metro Health Center, this brochure explains what?
This brochure explains the services that we provide for teenagers who are coming in for medical attention. We have 2 physicians, a nurse practitioner, Lisa Rebels, and myself as the teen counselor. And we also see patients, and if they need referral for special issues or special medical attention, then we make that available to them as well.
Center for Adolescent Health, Case Western Reserve University, celebrating 10 years, serving adolescent interests of Greater Cleveland.
Yes.
And this talks about similar services, referral, education, advocacy, links to the community. Yes, there are many
different arms to the Center for Adolescent Health, and the consortium is just one.
If, as we approach, what do we got, Chris, about another couple minutes, positive messages and helpful messages, resources. Where can an adolescent call or what contact number can they make to begin to find out some information or get some direction or support?
That's a great question. I'll start by giving my phone number, if that's okay. My phone number at Metro Health is area code 216-778-4784. I'm there Monday through Friday, 8:30 to 5. I have voicemail, so if I'm not there, I can certainly return calls.
And they could call you, Lisa,
they can call me if they have a question about,
if
they have a question about medical care or how to access certain services, I would be more than happy to give them information on how to do that.
And there's no dumb questions, right?
There's absolutely no dumb question at all.
And you're not going to judge them, but you're going to try to meet their question with the appropriate resource or answer that's necessary. For parents out there, real quick, 20 seconds, what do you say to parents?
I say to parents to let your daughters, let your son know what your concerns are, what your expectations are, and make sure that you have an open communication. I appreciated your remarks that it doesn't begin when your daughter or son is 15. There needs to be ongoing conversation and communication, and we teach our children how to ride a bike, and we tell them not to touch a hot stove when they're little, and then when they reach puberty, magically we stop communicating and assume they know how to interact and how to move into the world in a safe manner. I think parents need to feel confident that they can address any concern and also be open to listening to their adolescents so that adolescents can come to them if they have a particular problem.
Lisa Ellick, thank you very much for the information you've shared. The time has gone so quickly.
My pleasure.
Adolescents are our future. We need to cherish them and need to value them and be vested in them. We can see what happens when an adolescent is left alone to make his or her decisions without guidance. To parents, I will emphasize what she says, that we need to put the you back into youth. And if you look at the word youth, the first three letters are Y-O-U. And you can't spell youth without Y-O-U.
Absolutely.
Important reminder for parents. This is Just Chillin'. My name is Jim Joyner. I'm your urban navigator for this special edition of Just Chillin'. Thank you for being with us. And again, thank you for your information.
My pleasure. Thank you for asking me.
Yep.